This is what we use to apply the topical gel. If you're working on anything anterior, you're going to put the topical right where that tooth sits. So say we are doing topical for number 25, we're doing a filling. I'm gonna find number 25 and I'm gonna go directly below it and kind of just gently rub that in, and then I'll have her close her lips. Go ahead and close your lips. And then I leave it there for like that for about a minute. That lets it soak in. And then open. Anytime you're working on a lower, especially a lower tooth in the back, so you're doing a first or second molar, your doctor is typically going to block out that whole jaw where they get their tongue and their whole cheek numb. So if that's the case, I always like to take a little bit of cotton so that the topical doesn't run and mix with their saliva and go all over the mouth. But you're gonna have them open and you're gonna go all the way back here to this little junction where their jaw comes together, and you're just gonna gently kind of rub that in there. And then I like to do a swoop down because they'll probably infiltrate too next to the tooth. So I swoop down, go back up, and then I place, go ahead and open again. And then I place the cotton back in there, and then go ahead and close. And then I let that just soak in like that. And then I leave that again for 1 minute, and then open. But definitely for the blocks, you want to get as far back as you can and just kind of rub that in back there, because that's the injection that probably hurts your patient the most and is the most uncomfortable. So you want to make sure those tissues are good and numb before the doctor goes in to get them numb. Now, say you're doing like a premolar and you're not doing a real big procedure on the premolar and your doctor doesn't need to block. Same thing as the anteriors. She's just going to infiltrate, so you're just going to go directly below where the tooth is. You're just gonna gently rub that in and then have them close. Really, I only use the cotton to help prevent it from mixing with the saliva if we're going all the way to the back, because that's when it gets to the back of the throat. So then if you're going to the top and say you're doing a top molar back here, you'll just kind of gently pull the cheek, and then again, kind of that swooping motion over where that injection is going to be, which is going to be generally right next to the tooth. And then you'll just let them close and let them hold on to that again.